Last December, I had the pleasure of hosting Congressman Murphy in Florida for a mental health roundtable with stakeholders from the community. I commend him for the extensive amount of time he put into addressing mental health and substance abuse disorders. I also serve on the Veterans Affairs Committee, where we have extensively focused on mental health issues plaguing our veterans, our true American heroes. In 2012, Time magazine wrote that more U.S. military personnel, sadly, have died by suicide since the war in Afghanistan began than have died fighting there. Mental health is an important issue, and I'm glad we're addressing it. Thank you, Congressman Murphy. Question for Dr. Lieberman. Dr. Lieberman, training for law enforcement that addresses how officers can best approach individuals with mental health or substance abuse issues has been extremely important in my community. Training programs that establish a partnership between law enforcement and mental health groups have effectively been implemented in my district. Since this legislation provides the creation of such programs, can you provide some insight about what effective training might entail? What should law enforcement be aware of when encountering individuals with mental health or substance abuse disorders in the line of duty? How could a lack of training cause an escalation in these encounters?
Thank you for that question. This really is a very important but also unfortunate situation that's arisen in which the law enforcement and criminal justice system has become so intertwined with mental illness and mental health care. Every time I see, a terrible story about a mentally disturbed individual being subdued and possibly injured or killed by police, I'm thinking, why are the police called upon to be first responders? That's really not their training. And similarly in correctional officers in jails or prisons, because of the increasing number, that's not their training, and even if they do have some in-service training about this, it really is not sufficient. So I think both criminal justice, and it's interesting you asked that because just this past Friday, I was speaking to 500 attorneys in the Manhattan District Attorney's Office. They asked me to come down to speak to them about mental illness, what the nature of it was, what it looked like, and also how could they try and adapt so that they could better manage the process of judicially reviewing cases of individuals who clearly had mental illness. So this is a growing problem. I think training is important, both for the police as well as for the criminal justice system. But frankly, if we're going to basically launder our mentally ill through the criminal justice system, both juvenile and adult, we probably need to have mental health professionals embedded with the police and more present within the prisons and the jails. This is the new normal or the new reality, and we need to provide care where it's required. I was having a conversation with individuals at that meeting on Friday where I offered the observation that in jails you have, in adult prisons you have people principally who are adults who are either psychotic, with schizophrenia, bipolar disorder, possibly psychotic depression, and substance abusing. Predominant diagnoses. In the juvenile detentions, it's kids who have what are regarded as antisocial behaviors and conduct, but in many respects, I would even venture to say it's the majority of it, these individuals start out as individuals who have learning disabilities, or what's scientifically called pediatric cognitive disorders. They have dyslexia, they have ADHD, they have nonverbal learning disabilities, and they can't connect with the world socially, educationally, and because they aren't succeeding, they're getting kind of negative feedback, they react to it in a obstreperous or disobedient way, and that leads them down this path, and they end up in prisons. So it gets to what Patrick was saying about, we're sort of addressing this downstream after closing the barn door after the horses have left. But either we give a modicum of training to our law enforcement and correctional people, or we embed mental health professionals in it, or we really go for the big solution, which is preempting the flow of individuals into the legal system to begin with.
Thank you. Thank you very much. I'll yield back.